In 1994, when we were all introduced to the third bottom line reporting, a phrase that John Elkington coined when he argued that companies needed to prepare three sets of bottom lines. Basically, one, the traditional measure of corporate profit, the second being the company's corporate responsibility account, and the third being a measure of measuring your green account, being your environmentally responsible actions as corporate. So now we come to the fourth bottom line. This is indeed a subject that's new to most of us, but thankfully, at least the little that I know about it was introduced at Discovery when you first invited Brett, and maybe let me start looking at you, when you invited the members in business of the South African Institute of Chartered Accountants to start talking about this and create their awareness. So thanks for that opportunity. But with us in the panel, we are having Brett, as I've said. Brett Tromp is the CFO at Discovery Health, and who are the local champions of fourth bottom line, as you would have heard. We have got next to him Dr. Brink. He is the SADC Private Sector Constituency Chairperson, but has spent a lot of time and many years with Anglo American, where he was the Chief Medical Officer. We also have Leigh Roberts sitting next to Dr. Brink. Leigh used to be with Saica for some time and has decided to venture on her own after spending a lot of time on the integrated reporting space, and has become the integrated reporting specialist basically, and she currently chairs the integrated reporting working group here in South Africa. We've been introduced to Derek earlier, and finally right next to me I've got Kim. Kim Bromfield is currently with Saica as the Senior Executive on Corporate Reporting. Thank you, ladies and gentlemen, for joining us for this discussion. I think the little bit that we've heard from Derek, maybe, Brett, what drove Discovery to champion this fourth bottom line? Can you just give us some insights into it?
I just firstly thank you to Sindi and Nkonki for the invite. Really appreciate being here on behalf of Discovery. So it actually, it was beginning of last year, middle of last year. I went to a breakfast with one of my mentors, and and we were discussing around what I could do as a CFO to drive more productivity in my business. So that's where it started, and we actually just started brainstorming a few ideas around what are things that CFOs traditionally don't look at and should look at, and really came up around the health of workforce. And then what that led to was a conjunction in the US, where Derek was doing similar work, but there wasn't real traction in South Africa. So we did a study in our own operational area, about 2,500 call center employees, which have pretty static measures, so it was quite easy to measure across. We had their vitality status and data, and we also had their smoking status. And so just to start proving whether there was any truth in this fact, we ran this analysis, and what we found, based on actual measures, there was about a 15 to 16% difference in performance based on the health of our own staff and their smoking status. So we knew there was something there, and then we saw the Fabius example, and now there's another one done by Daniel Milan, and so on and so on. So as a CFO, the easy part for me was figuring out that there was an opportunity to improve productivity. It was something that I thought we could add value in, and it was also an audience that hadn't traditionally spoken about this before. We look at the hard numbers, but we've never quite cracked the human capital measurements in our business. And that's where it led to. I think that's been the easiest part. The CFO community that I've spoken to, which is a broad range of them, have actually been pretty engaging. I think the tricky part now is getting into the detail. actually reporting it and doing it is a lot harder than the idea. So the idea was lofty, and I think everyone generally buys into the idea, but you know, what's the next step? And that's really where we are now. We're in the weeds and we're debating it.
So is CFO being comfortable in being uncomfortable, taking the transformation of the CFO function further? Thanks, Brett. Dr. Brink, you've spent many years at Anglo American as the Chief Medical Officer, as we introduced you, and I'm sure health and safety is something that you probably comes as second nature to you. And across the continent, you've also spent time. What contribution are you making in this, especially as you sit as the SADC Private Sector Constituency Chair, in particular for this Fourth Bottom Line project?
Thanks, Cindy. And perhaps in my remarks, I'd like to get away from the reporting, because I think you can't report on something until you're doing it. And what I'd like to give you is just a little case study of how this happened in Anglo American, and it is around HIV. And at the turn of the millennium, around 2000, we were reaching a stage in the company when over 20% of the workforce was HIV positive. They were getting sick, they were becoming disabled, and they were dying. And it was one thing to say, well, this HIV epidemic, that's a government problem, they must sort it out. We knew as a business that wasn't going to happen. And we had to, as a business, respond to this particular health issue with something that was going to change the game. For us, that was introducing free treatment for people with HIV infection. At the time, we had no idea what it was going to cost. We had no idea of the long-term outcome. But we knew that we had to do something. We now have the wisdom of hindsight, and when we look back at that HIV treatment program, and not only just the treatment, but getting hugely engaged on the whole issue of HIV, which was a very personal health issue, we have found that the benefit to the company and to the employees of that engagement has been quite extraordinary. And all the money that was spent on the AIDS program has actually ended up in a saving to the company. We have reduced the cost of AIDS within the company by 5% by spending more money on it. We reduced the mean cost of HIV per employee by 14% by introducing treatment, and those are now validated statistics coming out of in-depth economic studies. So what came out of that, and when we look at what was the cost of HIV, the big buckets of cost were absenteeism, benefit payments to employees, and additional healthcare costs that you would incur. And simply by getting involved and doing much more to improve the health of people with HIV, we reduced absenteeism in that group significantly. We reduced the benefit payments, and we reduced the additional healthcare costs that would be incurred. And in so doing, when you look at HIV, but that's just one chronic illness today. What about diabetes? What about asthma? What about people who are just basically unhealthy because of their lifestyles? If we got engaged on all of these things as a company, we could improve the health of the workforce. And as a company, we will have direct benefit to the company coming out of that. We know that to be true. Equally, we're not just talking about employees. They all have families. They all have spouses and children. And you can extend that same initiative to the families of employees. And when you start doing that, you start thinking about society and the community within which your business operates. There is no doubt in my mind that if you have a healthier community, that has to be good for business. You create a much better marketplace for business. People are not spending their last money on trying to stay alive, but in fact, through their health, are able to engage much more productively in the economy. So to us, it just makes absolute intuitive sense that companies should be engaging in health issues. And this is the people capital of the business. It's a profoundly good investment to be making. And I think I should stop there and we can pick more up as we go along.
Okay, thank you very much, Dr. Brink. Leigh, let me come to you. As an expert in integrated reporting, how do you see this being integrated in your integrated reporting?
Yeah. Well, let me say from the outset that I really don't like the term fourth bottom line. I think that even John Elkington, who coined it, I think that he has moved away from that. It's sort of like in the 80s, where people wore these big shoulder pads. It's so 80s and 90s, so he probably shouldn't be referring to the fourth bottom line. So in the International Integrated Reporting Framework, which has been endorsed by the Integrated Reporting Committee of South Africa as guidance on good practice, they talk about 6 capitals. And if you remember when South Africa came up with its first discussion paper on integrated reporting, the world first in 2010, we spoke about resources and relationships. At international level, they decided that they wanted to differentiate between the broad terms of resource and relationship. So they came up with 6 capitals, one of which is human capital. So I fully agree that wellness should come into consideration of that capital, but it's only one factor in which a company should be talking about the relationships it has with its important stakeholder group, being employees. You really want to read an integrated report and assess what the morale is like. What are employees feeling? Because there's been all these research studies that if you have unhappy employees, then it carries through to the future financial performance of the company.
So the key thing is how it's called or what it's called and where it's actually pinned, but you agree with the principle.
Yes, and as one element of the broader capital,
Right.
human capital.
Okay. Great. Derek, I'll come back to you just now. Kim, from a reporting point of view, I think we all know from Accounting 101, in fact, even long before that, just basic accounting, that for something to be accounted for, it must be measured reliably, all those different basics of accounting. So from a reporting point of view, what is Saica's initial thoughts around this fourth bottom line or reporting on the human capital content of it?
Well, I think it's obviously important to provide useful information for users to make informed decisions about the future amounts, timing, and certainty of cash flows that the entity is going to generate. And as Leigh was alluding to, all of the capitals all have a part to play in the performance and the sustainability of that organisation. And so in terms of, let's say, looking at profitability, I think everybody would agree that, yes, healthy employees, employees who are active, etc., and who are happy, are more productive, and that certainly results in greater performance. When it comes to reporting, though, and I guess often when you're mentioning Accounting 101, I guess one would look at the financial statements, but of course corporate reporting is wider than that. You've got the integrated report as well. It is about providing information about the organisation that is useful to users. So the key thing there is going to be what information should be reported on. I think in terms of the way businesses are run, this is something which needs to be taken into account. If we look at integrated reporting, there is integrated thinking, which takes into account all of these capitals in making decisions. Do you only focus on making as much money as you can and you don't worry about the environment, and you don't worry about your employees? Although, I'm sure others would say, well, maybe that isn't going to result in you making enough money in the long run because of the costs involved. But you do need to consider all of those aspects. But when it comes down to reporting, that for me is something which has to be investigated and developed into what should be reported. What information is going to be useful to users of those reports? And, many people who prepare financial statements, who read financial statements, or integrated reports as well, would say, well, they're rather lengthy documents. there is lots and lots of information. So I do think the challenge there is going to be finding the right balance and finding information that is relevant. So I'm sure we'll get into some of the metrics, but, you know, for example, if one metric is disclosed, and I think it was perhaps talking about, you know, smokers. So if companies were to disclose, well, you know, 80% of our staff are smokers, what are users going to do with that information? Does it mean that, oh dear, you know, these employees are unhealthy? Well, maybe in another organization where only 10% smoke, maybe those 10% are even more unhealthy because they don't eat particularly well or whatever the kind of thing. So I think for me, it's going to be finding that right balance and finding information which users are able to use in the right context.
Sure. I guess then, if I may come back to you, Derek, you've spoken about surveys that have been done on some of those large multinationals. The question is, in following from what Kim is saying, in terms of that data, the information that gets zeroed in developing a matrix, what kind of information is there? Is the information, can it be tangibly measured or figured out? What has been your experience?
Thanks. And maybe first to just respond to one of the points Kim said. I was in a very interesting meeting a couple of months ago in the US, which included the CEOs of some of the leading corporations, from AT&T to UPS to Merck to a range of them, Henry Kravitz and the KKR Group, one of the largest investment groups in the world. And one of the senior people opened the meeting saying, why do we have to worry about the health of our employees and why do we need to report on it? It was very interesting that his first response was to say he knows all the evidence on the impact of that on the bottom line, long term. That is beyond doubt. He knows that it's important because it will particularly lead to substantial savings in terms of healthcare budgets, and the US, the employer, bears the burden of that. So there will be multi-billion-dollar healthcare budgets which get reported in the bottom line, yet nothing in the reporting about the preventability and reduction on that big cost item. A bit insane, you might say. But he said there's a third reason why it's important. It's important because it's the right thing to do. Very rare to hear CEOs, in a closed meeting of CEOs, saying that in the same way in the past, we didn't believe it was the right thing to have people lose their arms and legs. Today we've learned a lot more. It's the right thing to stimulate productivity, maximize the health of people, encourage lower smoking rates, because it's the right thing to do, and it's justified by the data. So to go back to your question, I don't think we would ever envisage in a final committee a group of auditors sitting around going through the smoking rates, the body mass index, and all of these things. They would get an integrated score that combines the measures that go into the report. I was starting to mention some of the components you put into it. The people who need to act on that score would be the Chief Health and Medical Officer, would be those in HR and the rest of the company. But we need to have a way of putting it in a way in which it shows a tangible relationship between the underlying preventability of risk in a company and the ultimate gain for productivity and long-term profitability. So they may end up having 3 or 4 measures. I gave the 3 complexes that may be there that they would need to act on. In much the same way as I worked in PepsiCo for a long time. The final Audit and Finance Committee don't go down to look at the source of every possible water output or the level of salt, sugar, and fat in every single product, but they have an index on the healthfulness of the product portfolio, the savings on water, and so on, at a macro level. And they know they're doing it because it's material to their bottom line. So I think, I would say that what Leigh is saying about seeing this in an integrated way applies when you start building the specifics around a health metric. They too need to be an integrated synthesis of those things that matter.
Thanks, Derek. Brent, to get back to you, and probably Dr. Brink can also answer this question. After that engagement with some of the corporates last year, early this year, you then launched this fourth bottom line. what has been the reaction of other corporates that you've been engaging in this regard? And maybe, Brett, you can pick that up, but Dr. Brink, the SADC link, why the SADC link, why is it important in this regard?
I think on that question, the first real endorsement that we got, whatever the name is called, because I think there's debate about what it should be called around looking at the health of the workforce and the greater community. The first endorsement we got was actually from the SADC. So for those of you that aren't too close to it, it's 15 health ministers that met in Zimbabwe, and we did a very brief presentation, Brian and I were there, around this, and we got quite unanimous endorsement at a governmental level of the principle it was the right thing to do. Why? Because I think the government sees the value in corporates taking more responsibility for the health. That obviously releases the burden on the state, which is a big issue in South Africa. So they saw the value with it. They're very keen to engage. Really in South Africa, the engagement has been around more one-on-one meetings. We've had a few sessions like this where we've engaged with the CFOs, but we've been very cautious and careful to have rolled out a principle while we're still working through all these issues. So obviously we've got to get the reporting right, we have to get the metrics right. So people do buy into it, but they're waiting for what this final product, if any, will look like, and then really give it its stamp of endorsement. We do have a few big corporates that said they will work with us, that have openly come to us and said, look, we're willing to disclose some of this. Discovery Health will be doing the first attempt in our integrated report coming out soon, and then we'll take it from there. So there is excitement, but there's cautiousness at the same time.
Okay, thanks. Brian, anything on the SADC link?
It's so understandable that the Ministers of Health should really get engaged on this, because the workforce is a huge section of the population, and if you take the families as well. So if through employment there's interest in ensuring health, that, as Brett said, can take a huge burden off the state in terms of what they have to provide. And we've had a bit of a discussion around, what might some of these metrics be that companies would be using. One, for example, might be, so what proportion of your workforce has health insurance? And ideally, you would want, through employment, everybody to have health insurance, which creates a predictable, sustainable form of financing for health. So the business sector can get involved in that. I'll give you another metric which I think is hugely important, is absenteeism. And my experience of most employers is that when you start saying, do you know what your absenteeism due for medical reasons was, if they do it, they can't take you any step further, because I then say, so how many of those medical absentee days were due to illness and how many were due to injury? Because the injury side is all about safety and safety in the workplace. Actually, all the accidents happen outside the workplace, or far more. So these are metrics that in business you can start using. When it comes to SADC and the Southern African region, and you start looking at the burden of disease within society, one of the huge issues is migrant workers. Migrant workers move between countries a lot in Southern Africa. And when they move, they bring with them or take home with them disease which they've acquired. So they're mixing it up between states. And a really good example of that would be tuberculosis. Somebody might come and work in South Africa, get tuberculosis, get treated in a local hospital, find out that they've lost their jobs, and then go back home to Mozambique, but then the treatment gets interrupted. There's no continuity of care. And then what happens? They get drug-resistant tuberculosis, which is a nightmare. And they start spreading that within the community, and then it comes back. And so these diseases, unless we can start in the region doing something about the burden of disease, we're not going to develop economically. Another really good example is malaria. Mozambique has a huge malaria problem. And that filters over the borders between Mozambique and South Africa and Swaziland and Zimbabwe. If we can't work as a region on health issues, we're going to never lower the burden of disease, and we will never realize our full potential for economic growth and development.
Thanks. Kim, if I may come to you, because it's clear that there is an acceptance of the principle of investing in wellness of human capital. But from a Saica point of view, and I know we've discussed this earlier, that Saica's presence and availing its members in business for that initial engagement doesn't necessarily mean endorsement, because there's still a number of steps that need to be taken. Does Saica envisage putting a task team? Is there a task team? What are the steps to lead to that sensible state? What is out there? What is happening in the background from a Saica point of view?
Well, Saica and obviously its members certainly are happy to engage and find a workable solution. As I say, just as there are all the other capitals as well and disclosing information, it does go back to what is useful, what is relevant, what do users want, and how they're going to use this information. I think, as I say, just in terms of a management process, the evidence appears to speak for itself that there are huge benefits from having a healthier workforce. Just the question around, well, what information should be disclosed, just as in other parts of the capitals as well. Obviously, on the financial capital, you've got accounting standards which have set out the requirements. The question for me would be, the users of those reports, what information do they want? And therefore, do they want an overall metric of the healthiness of an individual, and that's what it is? Do users want to know the number of days the employees were absent, and then what are they going to do with it? So I think just as in financial reporting, the users drive the demand for the information, because that's the whole point of reporting. So the question is who are the users out there, and what are they demanding? And in that way, working together to find out what information should be provided. Because otherwise you could, end up with a situation where it becomes very burdensome on preparers, needing to go and collect all this information, etc. And they may feel, well, it's just a compliance exercise of putting it out there. Is it really being used? Or does it just fall into pages and pages of other information about depreciation rates and things like that? And people go, well, okay, So it is really about finding that right balance. Sure.
Sindi, there's a very simple question that companies need to be able to answer. How healthy is your company? We'd like to know. And you might need some measures, but in the end, we want to know, how healthy is your company? We might also want to know, how healthy is your marketplace? Because you're selling into that marketplace, and if it's sick, it's not going to be good for your company.
I think it's a good point, and then Leigh, from an integrated reporting point of view, is this something you see being further unpacked within the human capital reporting in the integrated report? So that is where probably all the work that's taking place in this great initiative needs to be channeled to proper fruition.
The Integrated Reporting Committee of South Africa, which is chaired by Mervyn King, each year we tackle a technical project. And actually it has a number of organizational bodies, Saica being one, Institute of Internal Auditors. Pretty much every major professional organization is a member of the IRC of South Africa. So I don't think that we would take it on as a specific a technical project. We may well leave that to the IIRC, the International Integrated Reporting Council, to perhaps work in that area. But what I wanted to say that it may help companies when thinking about all of this and thinking about how it all fits together is the IRC of South Africa has given as best practice the octopus model. So if you see the head of the octopus as the integrated report, that would be what's material to the company going forward and how it's going to, its impact on its capitals and effect on its capitals going forward. Because how you treat your capitals now comes back to you in future financial performance and price and availability. So if companies don't need to figure out what's most material, and they can go an integrated report when talking about human capital, and all the other detailed stuff can come as one of the arms of the octopus, say in your sustainability report or even your detailed human capital report. So that's going to be a differentiating factor, and that's why materiality is so important in integrated reporting. But the second point I want to make is that if you do these figures, I would like you to say in your integrated report what the outcome is. So you've assessed that a third of your workforce are smokers, and to mitigate that risk you make them sign up for smoke enders or whatever. So I want you to see in your integrated report what the outcome of that is, and what is the consequence on your human capital of doing that particular action.
Sure. Derek, do you want to add to that?
I think, what the question you're asking, and you're raising as well, is in whose hands, who's going to take action on this report? Who is the report? What's the audience? And it's actually part of the group in this room, but there are very many other groups, a few key ones. Let me just give you two very different examples. Clearly, the decisions, the asset managers, the decisions that are being made inside the big reporting structures, the Dow Jones Sustainability Index, the index is used by analysts when they decide whether they should increase investment, not increase investment, hold the investments the same. And the good news is that in the case of Dow Jones, Rebecca Sam, who oversee the structure, is spending a lot of time this year looking at how they can define the health metrics exactly for the rationale we've heard, not because it's a nice thing to do, but because they know that the asset managers are asking the question, and investors, how do we actually place our investments in a way that we're going to get an extra yield over the long term? And they know that a lot of the environmental gains have actually been discounted by the people because they've now reached a level of, a basic level of support, whereas in health, we still have a long way to start doing it. So somebody looking through the report through that eyes and seeing, well, actually this is an aging population with growing risks in terms of chronic diseases. They know now that the underlying productivity of this company, even if it's not bad today, is going to be a threat down the line. They better start adjusting their investment decisions accordingly. That's incredibly important. But there's another group who are increasingly looking at these reports, and these are the consumer-led groups. They are the ones who buy the products and services of the companies, particularly the consumer goods companies. And they are the ones who are starting to increasingly get organized and to say, we want to reward the companies that are starting to sell us healthier food or lowering the risks of many of the chronic diseases that we're seeing. And we're going to vote on whether we like the companies or not by what we buy at the point of sale, which in the end drives the profitability of the companies. And there's a whole network now of these consumer-driven groups who are starting to take the consumer perspective that, again, they require as their base information exactly the same data that would be in an integrated report. So these integrated reports are playing a wide role, all the way from consumer and consumer decisions through to the asset managers and their decisions, as well as to the person sitting in a company who's trying to maximize the health of their workforce.
Sure, thank you. Looking at some of the questions that are coming from the floor, and I know from Discovery there's Chipo, who's the head of sustainability, to make sure that we get, Chipo is sitting over there, questions that are much more meaningful. I do see a few interesting ones here. But I think one that probably I will ask the panel, there's a question that says, do you think that a mentoring program could improve mental health? I know it's not saying much about reporting, but I guess it's talking about those risk management activities within an organization, probably a formal mentoring program.
Well,
Derek.
I'm not going to answer that per se, but first I'd like to congratulate the person for asking the question for one very important reason. We don't talk about mental health in the workplace enough. It's highly stigmatized. Very few times do you have the CEO of a company standing up there and saying, we are focused on the physical health of our employees. We actually need to address the fact that depression, anxiety at work, stress at work are actually big, if not bigger, causes of productivity, morale, and retention than many of our physical factors. And when they start doing this, we will see that there are many opportunities to intervene. Mentoring programs are one. There are online support services are others. There are a wide range of ways we can do it. But the first thing is we need to have the recognition and voice of CEOs saying this is important. Mental health is as important as the physical health of our employees.
Thanks.
That question, the word mentoring brings up a lot of thoughts to me, because I find when you talk to businesses, they buy into the concept. They say, that's great. We like it. We understand it. How do we do it? What do we do next? And a lot of businesses simply don't know what to do. So when it comes to mental health, that's a big issue. We'd like to do better on that, but we don't know how. So we need to have some programs where people can come in and say, thank you for the interest. We can show you what works, what really makes a difference, what in the end will give you results which will be better for your company and better for your employees.
Sure. A few comments here, which probably might help to hear. Brett, someone in the audience says maybe let loose of the term fourth bottom line and focus on the integrated report, and that might give traction to this great idea. But again, there's a sense that it's Discovery trying to create your own market. We're in business. Do you want to comment? Or?
Yeah, I mean, look, when I did it initially, it was a personal journey for me to look at as a CFO. And I'm not a reporting CFO, I'm an operational CFO. I deal with the businesses very hands-on. And I was looking at ways of improving the financial bottom line of my business. And absolutely, I think being in that space, I had it more in the back of my mind. And obviously, when you come down to these metrics, maybe Discovery will be able to help our clients report in an easier, more affordable way that could potentially then lend to growth in our business, absolutely. But, it doesn't start like that. I think, what Adrian shared with us a few years ago was around shared value and how do we contribute as a company and into society, and how do we share the value of what we do with our clients. And we've got some interesting stuff we've launched now on the invest side, just to say if you, and linking into life insurance, if you behave this way, instead of taking all the profits, we transparently share them back with you as our members. So yes, it can, but like Brian said, if we've got good communities and healthier and stronger communities, it's good for all business. And that's why, it's strong for the government and stuff, and absolutely. And I think just to add, which is what a lot of people don't know, and it's not typically what happens in South Africa because we've got the big three disease burden. But around the world, we've got this little formula, I think it's now 5-5-75, where 5 lifestyle behaviors, so inactivity, smoking, mental disorder, causes 5 major causes of disease, diabetes, cancers, there's 5 of them, which causes 75% of the deaths. So people don't realize that people around the world are not dying from the communicable diseases, they're dying from the non-communicable diseases. So there's lots that we can do as employers and as financial people. And for me, it was just waking up a dormant giant in the financial sector and where I work, is that we don't take these seriously as financial people. I'm not saying others don't, but personally, and when I'm speaking to people, is that the financial people, this is not top of mind because they're not aware of the way the world is moving. And like Derek said, this is for sustainability. This is not short term. We're looking long term. Yeah, that's about it in summary.
Sure, thanks. Chipo, yeah. There is Chipo, the head of sustainability at Discovery. Let's not turn this a Discovery session, but yeah.
Yeah, well, somebody made a comment about maybe we should make this Discovery bottom line, but I don't think so, not today. I think to Brett's point, and I just wanted to contribute that I think there's a lot of work that's been done by a number of companies I've also had the benefit of having worked at Cadbury, but also having worked for GBC Health, and this is how the SADC private sector constituency was born. Within that context, there are 40 companies that have got significant platforms, or rather operations, within the SADC region, but also in sub-Saharan Africa. And I think the point really that I would like to emphasize is that there's a lot of work that's being done by companies in this area. It's really, for lack of a better word and analogy, it's not rocket science. And the referencing of companies that are doing work, I mean, when we talk about mental health, we've got ESCOM, we've got the mining companies, Rio Tinto, we've got Shell. They all have large-scale employee benefit programs where they are able to report. So some of the work that we are asking for in terms of these matrices that we're developing, I think to Brett's point, maybe this is not something that the financial gurus have looked at, but it is something that is out there, and it will be easy for us to be able to get the reporting. So I think in response to some of the comments, we definitely do not see this as something, significantly pointed at just discovery, but it is something that's already underpinned in a lot of the reporting that companies are doing. But we probably have not given guidance to the right questions to ask for us to be able to, and I mean, I look at these questions, what is it, how healthy is your company? And I think that's what we're all getting to. So it is a journey, and of course, we also appreciate the fact that we are pioneering in this space, but we want to pioneer together. So I just thought I should just add that, and I think that both Derek and Brett have been able to give further insights into that.
I think, Chipo, that helps, especially when you talk about the other organizations that are actively working with you guys, and that it's not just a one-man show situation, but you collaborating in this space. And maybe, Leigh, there's a question here, probably you could also look at it. It says there's a recommendation that then health, we should have health in our risk management processes that then lead through to the reporting. Can you expand on that?
Yeah, well, that's exactly right. Your risk management process as a company should include all of your important capitals. So all of those 6 capitals should be considered in your risk management process. Otherwise, you're excluding things. And that was a problem with the global financial crisis, that everybody concentrated on financial risk and forgot about all the rest. So absolutely, it should be a part of your risk management process. And I think on the reporting side, if it comes into the KPIs of a company, the strategic KPIs of that company, then it should be reported on, and the chief executive. It should go into determining his or her remuneration pay. And not only them, it should be filtered all the way down to the lowest employee who gets performance rated for carrying out the objectives of the company.
Sure, thank you very much.
Bring it to the health thing. How many companies have done a health risk assessment for their companies?
How many companies have done a health risk assessment? So the audit committee members and the risk committee members who are here, that is a question for you to to stay with. I want to come to each one of you to just give me the closing remarks because we are about to break for lunch. So let's reserve those points then for that. Kim, your closing remarks.
Yeah, I think it sounds great, and I think we're just going to find, the right balance in terms of providing useful information.
Derek?
I love the idea of making some of the marching orders for people here to go and do a risk assessment for the companies. But make sure you look at 3 domains of risk. Your employees and how their current and future health status could constitute a very significant risk to the long-term profitability of the company. How the very products and services being produced by that company represent potentially major threats on the liability, regulatory side and consumer resistance side. Very different set of issues. And thirdly, the point Brian stressed, that your engagement with community may be undermining your long-term profitability. That also represents a risk. I think starting to produce those kind of reports would be a spectacular step forward.
If it's material to your company's future value creation ability, which is the consequences on each of those capitals, then it should be in your integrated report. And remember that it need not be monetized. So the International Integrated Reporting Framework allows both qualitative and quantitative information.
Great.
I have to say, oh dear, because the last two speakers have just said exactly what I want to say. Derek's summary of the health risk assessment is perfect, and then the materiality of whatever issues come out of that assessment is what's important. If it's not material, forget about it. But you know, if I was on an audit committee and they came and said there are no material health issues in the company, I would go back and say you didn't do the health risk assessment properly, because there are, for sure. And you know, one of the leading ones in most of our companies is substance abuse, for example. And we know that's happening. How are you engaged with? What are you doing about it? So anybody that comes back and says there's nothing, you haven't done the job properly, please go and do it.
Wow, great. Great.
I think my message specifically to the accountants and CFOs in the room is that, you know, as a group and as a country, we're leading in this space if we get it right. We really have a chance to leave a legacy in South Africa that can be transported to the rest of the world. And this is not about one company, this is about a collective effort. And if we can get this right, it goes far beyond just profits and stuff. It's the impact on the people. It's the right thing to do. And that's what drives me to do it, is that, you know, I can look back and go, we made a sustainable difference in society, rather than just, did we get the profits, did we get the reporting? This really impacts on that level.
Sure, no, thank you very much. I see this team wants to keep you unhealthy, not having your lunch, but Derek wants to, one last point.
I just want to expand on what Brett said, because I think I'm unique on the panel that I don't live here. I love the country, I love what you're doing, but I sit in New York. And so I have the privilege of working with the World Economic Forum, Clinton Global Initiative, and many of the international players. And it's often difficult for people locally to understand that what you're doing has global relevance. This is in the forefront of what is going to become the norm long term. So even though you may think this is just for South Africa, it isn't. As I said, our CEO, Adrian, was on the panel with the Director General of the World Health Organization, Chelsea Clinton, and one of the largest foundations in the world, where the one big message he made was, we have to start getting these health metrics right, because it's important for all companies worldwide. And the last thing I'd leave you with is just a simple shift in the way we think about wording. Somebody was hinting that, well, isn't there some conflict of interest in a company like ours being engaged in this? I would say there's a confluence of interest, and we should always play to the confluence where the link between profitability and social benefits come together. That's what shared value is about, and that's what we are unashamedly trying to push.
Wow, thank you very much. Chipo, last word.
Thank you very much, Sindi. And I think Derek has absolutely captured it, and I'd like to kind of deny that even more. We have a very unique opportunity, because this is a collective response. It is not about discovery. It's a collective around how we can engage better as corporates. And for us, November the 18th and 19th, the ministers are meeting. We will be providing a full report back. And part of the report is how we pull in the consultations. Ministers are not looking for one band companies. They're looking for a collective. We've already got 40 other companies that are engaged. So we would like to ask if there are any audit members who are in here who would like to be part of the process. We definitely want to work on this as a collective. Thank you.
Thank you, and I guess Nkonki has also given you a platform to take some input into your consultative forum. Thank you, Chipo. I'd like to thank my panel members. Thank you very much, and Derek, especially to you for having come all the way to make sure that this is indeed an international engagement and interaction. Thank you very much.